Are you tired of painful cramps and not knowing when you are getting your period? Would you also like the added advantage of prevention of pregnancy? Using contraceptives can only benefit women. It is a good way to prevent many things from occurring in the woman's body, such as ovarian and endometrial cancer, as well as preventing unwanted pregnancy. Women use contraceptives to have healthier lifestyles, and couples use them to help time and space births and achieve their desired family size. There are a few different reasons why women use contraceptives. They can help aid in the number of ways from preventing pregnancy to preventing anemia. I am Taylor Christensen, and this is a persuasive essay on using contraceptives. To prevent pregnancy. The rate of effectiveness in preventing pregnancy is high. When used correctly, contraceptives are extremely effective at this. It is a way to prevent unwanted pregnancies from happening. The 2/3 of U.S. women at risk of unattended pregnancy who practice contraceptive conception consistently and correctly account for only 5% of unattended pregnancies. The United States has the highest rate of pregnancies and births in the Western industrialized world. 34% of young women become pregnant at least once before the age of 20. This is about 820,000 a year. Teenage pregnancy can decrease your chances of living the normal teenage life. Teenage mothers are less likely to complete high school as well as going off to college to get a degree. Most of them cannot afford it and end up on welfare. Children that are born to teenage mothers tend to have lower birth weights. This can cause them to fall behind in school and also have a greater chance of being abused or neglected. Boys of teenage mothers are more apt to end up in prison, and girls have an increased rate of being a teenage mother herself. Not only does using contraceptives prevent pregnancy, it can also help with the regulation of menstrual cycles in women. Regulate or prevention of periods. Regulating menstrual cycles can help prevent anemia from occurring. The hormones in the birth control keep the lining of the uterus thin, so there's less blood loss, resulting in decreased chance of anemia. By regulating and preventing a period, it can make it easier to stay active. Some birth control methods can regulate a person's period when it would otherwise be irregular. Birth control contains hormones similar to a woman's own body, and when taken on a regular basis, the menstrual cycle is regulated to a cycle of desired length. This allows women to stay active knowing that she will not have a period when it is unwanted and can make certain it is a light period. It is also a way to know that there are no other physical problems that are the cause of the menstrual irregularity. The first line of treatment for irregular menstrual cycles is typically going on a form of birth control. If the birth control regulates the menstrual cycle, then it is a sign that there are no other physical problems, such as thyroid issues or pituitary tumors. By eliminating the period, a woman can help control endometriosis. Birth control is one of the first choices for controlling this disease because the hormones in the birth control are the hormone therapies that is least likely to cause bad side effects. They also help aid in inflammation and pain causing prostaglandins. They can stop or slow the further growth after endometriosis surgery. They cannot cure it but can slow or relieve symptoms from occurring. Along with regulating menstrual cycles, it is an added advantage of decreasing or eliminating menstrual cramps. Controlling of cramps by taking birth control, women can decrease or eliminate pain. Birth control methods work in different ways to minimize pain. It is by the regulation of hormones and prostaglandin release that cramps are decreased. It allows women to participate in activities that may otherwise be not involved in. The regulation of hormones and release of prostaglandins also decreases the amount of cramping that women experience. Some women are literally due to bed to severe cramps, which prevents them from attending school, work, and participating in other activities. Using contraceptives have multiple reasons as to why to use them. The different kinds of birth control. The pill contains estrogen and can help in regulating a person's period, decreases cramping, and decreases the chance of anemia. It can also prevent chances of endometrial and ovarian cancer. The pill is easy to use. It is taken once every 24 hours at the same time by the mouth for 3 weeks, and then the last week there are no pills, except for the sugar pills that you take to regulate your cycle. The patch does the same thing as the pill, except that it is stuck onto the body and is changed every week for 3 weeks. On the last week of the month, no patch is worn to let the woman have her menstrual cycle. The ring also aids in the same as the pill and ring, but this is put into the vagina for 3 weeks and then taken out for a week. Depo-Provera shot contains only progestin and does not regulate periods, but can minimize the amount of bleeding or eliminate the period. This will decrease chances of anemia and decrease or eliminate cramping. The shot is given to the woman every 3 months, intramuscularly, either the arm or the hip. Implants only contain progestin. The advantages of this are the decrease in the amount of bleeding, and it is easy to use. Once it is implanted into the inner aspect of the arm, you do not have to do anything with it. The intrauterine device decreases and or eliminates cramping and bleeding. It is a long-acting birth control method, either 5 or 12 years, whatever the woman chooses. This device is put into the uterus. As you can see, there are different methods you can choose from. It all depends on what a person likes the best. And of course, every option can be used for prevention of pregnancy. Birth control has many other uses other than for the prevention of pregnancy, though. Birth control may not be for everyone, but is a great thing to use if a woman is trying to prevent unwanted pregnancies, help regulate her menstrual cycle, and help to control the regulation of cramps. If you are not on contraceptives, it is highly advised to use them. It can only benefit you now and in the future.